Hi, and welcome to our video on cybersecurity in a SaaS environment, MedixSys Solutions. I'm Tharani Asov-Kumar from the Bachelor of Computer Science at Inti International University. MedixSys is a Singapore-based healthcare application service provider, ASP, that supplies more than 40 healthcare clinics and specialty hospitals across Southeast Asia with its cloud-based electronic health records, EHR, systems. This video is an attempt to highlight the importance of cybersecurity and how it makes a huge impact, especially in healthcare, where privacy-related data is widely used. A huge data breach affected MedixSys of more than 55,000 patients' records in February of 2025. With SaaS-based e-health platforms being a frequent target for ransomware, this is another obvious reminder that cybersecurity must be at the top of the ranking. Let's see what are the ASP, SaaS, and MediLink 360 stand for. ASPs are application service providers that deliver software applications over a network, typically the internet, as an alternative purchasing and installing the software locally. As said before, software as a service, SaaS, is a software distribution model where applications are hosted by a third-party provider and accessed by users over the internet. MediLink 360 is MedixSys SaaS offering for manage patient records securely, automate appointment scheduling and billing, access real-time patient data from any authorized device and generate prescriptions and lab orders digitally. Silvercare Clinic Group in Malaysia, a regional chain of elderly care clinics in Malaysia, subscribes to MediLink 360 via a monthly per-user fee. All their patient data, medical histories, and billing records are stored on MedixSys's cloud servers. Now, let's have a look at the dangers that MedixSys faced. In February 2025, MedixSys suffers a major cybersecurity breach due to a zero-day vulnerability in an outdated third-party plugin used in their web application firewall. Although the data was encrypted, encryption keys were stored insecurely on the same server. These are some common SaaS vulnerabilities that have been identified. Insider threat and data breach. Inaccurately configured cloud storage. Ransomware. Unauthorized data exposure, service outages, and regulatory violations. The breach went undetected for 9 days. Attackers demanded a ransom in Bitcoin after leaking sample data on the dark web. Now, let's see what the security issues identified are in this case. 1. Weak security governance, no formal Security Operations Center, SOC, or dedicated CISO within MedixSys. 2. Poor patch management, known vulnerabilities remained unpatched for 5 months despite vendor alerts. 3. Improper key management, encryption keys stored without key vaulting or separation of duties. 4. No SIEM or intrusion detection, lack of real-time security event monitoring allowed prolonged exposure. 5. Unclear responsibility in SLA, the Service Level Agreement, SLA, did not specify incident response time, data breach notification timelines, or liability clauses. Because of the security issues were identified, let's look into what are the consequences they are facing now. Client fallout, 5 major clinic groups paused or cancelled their subscriptions. Reputation damage, MedixSys was featured in several news outlets as an unsafe health tech provider. Regulatory action, the Malaysian PDPA office launched an investigation and fined MedixSys Rm 1.5 million. Operational disruption, clinics reverted temporarily to manual record keeping, causing patient delays and trust issues. The foundation of secure SaaS platform is its security policies. However, MedixSys did not have a designated Chief Information Security Officer and an official Security Operations Center in place. Security policies are used to control access to data, implement proper and secure password policies, establish incident response procedures, and the CIA triad is in line with these policies. C is stand for confidentiality, ensures that sensitive information is only accessible to authorized individuals or systems. This means preventing unauthorized disclosure or access to data. I is stand for integrity, focuses on maintaining the accuracy, completeness, and trustworthiness of information. It ensures that data hasn't been altered or corrupted, either intentionally or accidentally. A is stand for availability, guarantees that authorized users have timely and reliable access to information and resources when they need them. It is clear that MedixSys did not apply these principles properly. Even though the breach for MedixSys was due to a software vulnerability, if they have a good physical security controls, it would reduce the risks and discourage exploitation further. For examples: 1. Access controls to data center/server rooms. MedixSys keeps electronic health records, EHRs, for about 55,000 patients in the cloud data center. Only IT staff with authorization can enter the server rooms, which includes biometric scanner, smart cards, and multi-factor authentication, and log all entries and exit by closes the logbook. Unauthorized physical tampering with servers, which could compromise decryption keys or databases, is less likely as a result of this. 2. Monitoring. CCTV cameras are situated at the entrance, server rooms, and storage areas, which should be used to monitor the security personnel. If MedixSys, we would have observed alarms going off at odd hours of the night if we had used this system carefully. 3. Protection from physical disasters. Data centers should be protected from fire using gas suppression systems. In order to prevent equipment failures, climate control systems maintain the appropriate temperature around servers. 4. Protection of hardware/devices. Encryption keys should not reside on the same physical server where the patient's data resides. Keys should be protected in hardware security modules, HSMs, which should be secure from the thieves. Need to secure the server racks with locks protection. 5. Disaster recovery in case of physical/digital disasters. Encryption should be used to protect sensitive data. Encryption is a method of locking data so that only the person who has the key can read it. It converts data into encoded text. The medical history and billing information of MedixSys patients are sensitive without the decryption key. Attackers who gain access to the data will be unable to read it. 1. Data in digital form. When all the patient information is stored in the cloud, it should be encrypted. If hackers break into the database, then the information will be transparent as random letters and numbers. 2. Data in transit. The MedixSys and clinics must use secure connections to protect patient data when it moves between transport layer security or secure sockets layer. This will prevent attackers from reading or altering the data as it travels through the internet. 3. Key management. Encryption is only safe if the keys are secure. The problem with MedixSys was that the encryption keys were stored on the same server as the data. This meant that attackers could easily unlock the records. Keys should be stored in a special secure device like HSM, hardware security module, or key vault, apart from the data. 4. Strong algorithms. For secure communications and files, MedixSys should use AES-256 and RSA encryption algorithms. It is simple to crack outdated or weak encryption. As a conclusion, the MedixSys data breach is a straightforward illustration of how every SaaS system vulnerability can be exposed by a single small flaw. Besides that, cybersecurity should be as a major concern by any vendor who is in essence an agent of application services with important data. Client interest and compliance is demanded by proper encryption and physical measures. So here, it is not after the fact that we are talking about breaches. Prevention should be the main concern here. Thank you very much.